I think one of the best things you can possibly do is following the post-op instructions that we hand out. A lot of the times patients just bypass them and call us directly or call the staff, but there's a lot of good information that's on our recovery sheets that we include. Among those tricks on the sheets are making sure to keep your sockets, especially the bottom sockets, cleaned out. So we'll send you home with a monoject syringe that we want you to start flushing out your bottom sockets with about 2 or 3 days after surgery when you advance to a more normal diet and you're not just drinking liquids anymore. Another thing you can do, especially the first 2 or 3 days, is staying ahead of the pain. A lot of patients wait until their pain has become really significant before taking medications, but if you can bounce between the Tylenol and Motrin every 3 hours or so, in most cases you can minimize or even remove the need of taking the stronger narcotic medication.